Chest wall deformities come in a couple different flavors. They're typically referred to as pectus, and pectus is an abnormality of the cartilage of the chest wall. It's not life-threatening, it can be life-altering. Some of the more severe forms where the chest is really scooped out, their exercise tolerance is diminished, and certainly there's a social stigmata. Some children do require a surgical correction of their pectus, and those are the ones that fold in because it can actually compress some things. The heart can shift, the lung volumes can be diminished, and in those kids we need to get the chest wall pushed back out, and there are two techniques to do that. One is referred to as a more minimally invasive technique, and that's similar to braces on your teeth. This is an example of a bar. The bars are custom made for your chest wall dynamics. A small incision is made on either side, and the bar is actually put in upside down, and then with watching it directly, we flip it, and that way your breastbone pops back out immediately. The surgery is pretty quick. I can do it within about 45 minutes. Most of the kids are in the hospital for about 3 days after that, and that's adjusting their pain medicines. And then each week they're allowed to do a few more different activities. 2 or 3 years later, we go through the exact same small incisions, straighten the bar, and remove it. And you go home that afternoon. So the actual operation of removing it is about 30 minutes. You go home that afternoon, you're sore for a couple days, and you're back to your regular activities. Another technique is used for someone that has what I call asymmetry, and that is the chest wall is crooked. And then that is one small incision through the front, usually right at the base of the pectus. A lot more work underneath, and that involves me cutting some of the cartilage to get the breastbone out to where I need it to be. It's suspended, and then the cartilage grows back into the side of the sternum. It's only one operation, but quite extensive. It takes 6 months before I will allow a child to play contact sports, but their ability to get up and move around and go back to school is fairly quick. The obvious improvement is, the physical change that occurs immediately. Now, the subtle improvements are more with respiratory function, just with their exercise tolerance. They couldn't keep up with their peers, which they were able to do 2 years ago, but now they can't. So that will slowly come back with time. Once a kid has self-confidence, everything else seems to improve as well.